I'll now introduce you to the OMM technique called suboccipital tension release. This can be used to treat tension headaches, it can prepare for cervical corrections, and also stretches the dural attachments between C2, C3, and the occiput. To do this, you want to take the pads of your fingers and place them on the posterior side of the patient's head, in between the occiput, or the back of their cranium, and C1, which is that first vertebra after the cranium, or below the cranium, I should say. You then want to flex your fingers into those dural attachments and watch for the patient's head to drop as their dural attachments stretch out. Sometimes it takes a few times to get your fingers in the right position. You really want to be able to hold your fingers up, keep them flexed, and see the patient's head drop into your hands. It's also important that your patient is relaxed during this entire procedure, this entire treatment, because you want your patient to actually be able to stretch out those dural attachments. And you know you've completed this technique once the patient's head falls into the palms of your hands. This is the suboccipital tension release.